16 signs your blood sugar is high and 9 diabetes symptoms. Blood sugar is fuel for the body's organs and functions. However, having high blood sugar does not provide a boost in energy. In fact, the opposite often happens, because the body's cells cannot access the blood sugar for energy. The human body naturally has sugar, or glucose, in the blood. The right amount of blood sugar gives the body's cells and organs energy. Too much blood sugar is known as hyperglycemia. What does hyperglycemia feel like, why does it happen, and how do you know if your blood sugar levels are too high? Watch this video to the end in order to find out more about the early signs of hyperglycemia, high blood sugar, and how to prevent diabetes. Are you new to this channel? Hit the subscribe button and click on notification bell icon to be notified when new informative video is published. Hyperglycemia is the medical term describing an abnormally high blood glucose, blood sugar, level. Hyperglycemia or high blood sugar is a hallmark sign of diabetes, both type 1 diabetes and type 2 diabetes, and prediabetes. Normal ranges for blood glucose measurements can vary slightly among different laboratories, but in general a fasting, early morning, before breakfast, glucose level is considered normal if it is between 70 to 100 mg per deciliter. Glucose levels may rise slightly above this range following a meal. Random blood glucose measurements are usually lower than 125 mg per deciliter. The liver and muscles produce some blood sugar, but most comes from food and drinks that contain carbohydrates. In order to keep blood sugar levels within a normal range, the body needs insulin. Insulin is a hormone that directs the body's cells to take up glucose and store it. If there is not enough insulin, or insulin does not work properly, blood sugar builds up. High blood sugar levels can cause health problems. Recognizing early signs and symptoms of hyperglycemia can help you treat the condition promptly. The early sign of high blood sugar include 1. Increased thirst 2. Headaches 3. Extreme hunger 4. Blurred vision 5. Frequent urination 6. Fatigue, weak, tired feeling 7. Weight loss 8. Blood sugar more than 180 mg per deciliter. If hyperglycemia goes untreated, it can cause toxic acids, ketones, to build up in your blood and urine, ketoacidosis. Signs and symptoms include 1. Fruity smelling breath. 2. Nausea and vomiting. 3. Shortness of breath. 4. Dry mouth. 5. Weakness. 6. Confusion. 7. Coma. 8. Abdominal pain. It should be noted that symptoms can vary from one person to the next. They also depend on which type of diabetes you have. However, the question people always ask is, what diabetes symptoms are most common to all types of diabetes? Although, your symptoms may look harmless. The most common symptoms of diabetes, such as increased thirst and fatigue, are often vague. When experienced on their own, symptoms such as these may not be anything to worry about. However, if you're experiencing one or more of these symptoms, you should speak with your doctor about being screened for diabetes. 9 diabetes symptoms. A. Frequent thirst. You've had glass after glass of water, but you are still not satisfied. This is because your muscles and other tissues are dehydrated. When your blood sugar levels rise, your body tries to pull fluid from other tissues to dilute the sugar in your bloodstream. This process can cause your body to dehydrate, prompting you to drink more water. B. Frequent urination. Drinking excessive amounts of water can cause you to urinate more. This may lead you to drinking more fluids, which add more to the problem. Your body may also try to eliminate excess sugar through urination. C. Extreme hunger. You may still feel hungry even after you've had something to eat. This is because your tissues are not getting enough energy from the food you've taken. If your body is insulin resistant or if your body doesn't produce enough insulin, the sugar from the food may be unable to enter your tissues to provide energy. This can cause your muscles and other tissues to raise the hunger flag in an attempt to get you to eat more food. D. Unexplained weight loss. You may eat normally and continuously feel hungry, yet constantly lose weight. This can be observed in type 1 diabetes. If your body isn't getting enough energy from the foods that you eat, it will break down other energy sources available within the body. This includes your fat and protein stores. When this happens, it can cause you to lose weight. E. Fatigue. Sugar is one of your body's main sources of energy. If you have diabetes, your body's inability to convert sugar into energy can lead to fatigue. This can range from a general worn-down feeling to extreme exhaustion. F. Blurry vision. Abnormally high blood sugar levels can also lead to blurry vision. This is because fluid can shift into the eye duct. This typically resolves once your blood sugar levels are normalized. This isn't the same as diabetic retinopathy, which occurs over time in people with chronically high blood sugar. People with diabetes are also at higher risk for cataracts and glaucoma. H. Infections or wounds that are slow to heal. If you are suffering from type 2 diabetes, your body may have a hard time fighting off infection. This is because bacteria can thrive when your blood sugar levels are too high. Women in particular may experience frequent vaginal yeast infections or bladder infections. High blood sugar levels can also stop your body's ability to heal cuts and scrapes. This is because high blood sugar levels can have a negative impact on your white blood cells. Your white blood cells are responsible for healing wounds. I. Numbness and tingling. High blood sugar can also cause numbness, burning, or tingling in the hands, legs, and feet. This is due to diabetic neuropathy, a complication of diabetes that often occurs after many years of high blood sugar levels. J. Long-term complications. Over time, high blood sugar results in harm to the body's organs and systems. Damage to the blood vessels can lead to complications, including heart attack or stroke, damage to the eye and loss of vision, kidney disease or failure, nerve problems in the skin, especially the feet, leading to sores, infections, and wound healing problems. People with type 1 diabetes will need to take insulin as their doctor recommends, usually several times a day. Those with type 2 diabetes or gestational diabetes may need to change their diet and exercise habits. They may also need to take oral medications or insulin. How to prevent high blood sugar. A number of strategies can help prevent hyperglycemia, high blood sugar. These include: people should check their blood sugar levels as their doctor advises and take the correct amount of insulin, if they have type 1 diabetes. Try to speak with your healthcare provider or dietitian about which foods to eat or avoid, how much to eat, and how often. Take precautions to avoid infections, for example, through regular hand washing, as illness, such as a cold, can trigger a rise in blood pressure. Plan your food intake and exercise to balance blood sugar levels. Try to minimize stress, as far as possible, for example, through exercise, getting enough sleep, and stress-reducing activities such as meditation or yoga. How to manage blood sugar levels. Many people with diabetes must check their blood sugar levels daily with a glucose meter. This device takes a drop of blood, usually from a finger, and displays the sugar level within a few seconds. If you have diabetes and notice any of the early signs of high blood sugar, test your blood sugar and call the doctor. They may ask you for the results of several readings. They could recommend the following changes. 1. Drink more water. Water helps remove excess sugar from your blood through urine, and it helps you avoid dehydration. 2. Exercise more. Working out can help lower your blood sugar. But under certain conditions, it can make blood sugar go even higher. Ask your doctor what kind of exercise is right for you. You have to be cautious. If you have type 1 diabetes and your blood sugar is high, you need to check your urine for ketones. When you have ketones, do not exercise. If you have type 2 diabetes and your blood sugar is high, you must also be sure that you have no ketones in your urine and that you are well hydrated. Then your doctor might give you the okay to exercise with caution as long as you feel up to it. 3. Change your eating habits. You may need to meet with a dietitian to change the amount and types of foods you eat. 4. Switch medications. Your doctor may change the amount, timing, or type of diabetes medications you take. Don't make changes without talking to them first. If you have type 1 diabetes and your blood sugar is more than 250 mg per deciliter, your doctor may want you to test your urine or blood for ketones. Call your doctor if your blood sugar is running higher than your treatment goals. If you have learned one or two things about high blood sugar and diabetes from this video, kindly share this video and give it a thumb up. Thanks for watching. You can check out other videos on how to naturally manage diabetes at home with herbs.